Hi, I'm Debbie, one of the specialist nurses from the drug and alcohol team in Wiltshire, and I come to Doorway usually every fortnight so that I can work with the people who are possibly homeless, who have used street drugs, who are drinkers, so that I can test them for Hepatitis C and inoculate them against Hepatitis B. Because lots of clients that we approach for this, perhaps within key working sessions, don't come in on formal appointments, but coming into Doorway where people are popping in for lunch is such a brilliant way of capturing all the people that I've been chasing for months, and you suddenly find them having their hot pot and mashed potato. They're like, yay! And people do want to have the screening and the vaccinations, but often with the chaotic lifestyle that they lead, me approaching them is proven to just be the sort of easiest way to grab people. So, and I love coming here because the staff, they know the client group, they're so respectful towards the client group, it's such a lovely environment for them. And the food is always wonderful as well, which draws the crowds in, I imagine. And I can have that consistency as well, that I know people will be returning sort of week after week, so that I can try and finish a course of vaccinations, because the Hep B vaccinations is 3 plus a booster a year on. I can be here to give them their Hep C results, and sort of any other queries that people have about Hep B and Hep C, I can just sit and have a chat with them. I know people have even asked me about NIPs before. I'm not a general nurse, but I'll quite happily chat to anyone who feels that they need it. So,
and the guests are quite comfortable with you, and
I think they are a lot of the time. I think there's still a lot of stigma attached to hepatitis C within the drug using community, and it's trying to just sort of work with that and take away the stigma. And say, well, it's okay, let's test for it, let's get you treated, which, you know, were the best options, and teach people how not to catch it, sort of, you know, doing harm minimisation work, so they can be much more aware of it. And sometimes when they say there's still a bit of a stigma attached, and I think I've had 1 or 2 sort of moments when people aren't that comfortable with me, but I'm not running around shouting, you know, come and get your Hep C test here. I'm trying to be very subtle about it. Yes, that's kind of what I do.
Fantastic. And without Doorway, do you say you would, if Doorway wasn't here, you end up chasing after them and then not being able to get to those people that use this facility?
Absolutely. I mean, it's just proven. I've just captured so many people that have been referred to me, and I've sent letters to come to appointments elsewhere, and you just stumble on them here because it's just one of those drop-ins everyone knows about, everyone goes to, and I just say, without Doorway, I think my figures would be much lower, quite honestly. And it's just such a pleasure because the staff are so nice and supportive, and they will often point me in the direction of, you might want to approach so-and-so, they may need a chat, or so yeah, it's made a big difference to my work.
It helps you.
Yeah. So.
Fantastic.